Um, Good morning, everybody. Welcome to BADIO Coronavirus Discussion Group. I'm Terencia Bordo. Thanks for joining us this morning. We have a pretty exciting morning this morning, and we are going to talk about the impact of coronavirus, which is the 2019 novel coronavirus. For those of you who haven't been on our show, we do this show every other week. So please, and we'll keep the time fixed, which is this time 11 o'clock, 11 a.m. The people at the show today are Mr. Rodrigo, Dr. Marcelina, and Dr. Kenan. This is the procedure we're going to follow. There'll be 5 minutes prayers or even less. And then I will summarize what we talked about during our last meeting here. And then I will introduce the topic for us to discuss. Thank you very much. Without having ado, I'm going to welcome Dr. Marcelina to pray for us. Thank you.
Let's bow our heads and pray. Heavenly Father, we want to thank you this time. We thank you for what you've done in our lives and what we are. Father, in this difficult moment where there's a lot of deaths, a lot of hunger, a lot of war, a lot of things going on, we are still alive. Therefore, we give you thanks for this. As we come to learn and be together and fellowship in this BADIO, Heavenly Father, give us that spirit of discernment so that whatever we learn here, we take it and make it useful in our lives, and we can also be able to impact others who we come across. This we ask you in the mighty name of Jesus Christ. Amen.
Amen. Thank you very much. Last time we had Dr. Ronalds, who introduced to us about the coronavirus and the impact of coronavirus. We learned that this virus is a new virus, but there were previous viruses before this one, and this is currently the one which is very severe or affects people very severely. And we've learned about the symptoms it causes. We learned about the signs. It can cause respiratory symptom problems. It can cause fever, cough, shortness of breath, and more. And even it can cause severe cases where someone gets pneumonia and severe respiratory problems. And this disease has now become pandemic. We've learned in that as on the 27th of this month, worldwide, we have now 9,119 cases and 525 confirmed cases include, the death or the people who died were 497,255. In UK, confirmed cases were 309,360. And deaths were 43,414. In South Sudan, we have 1,942 cases confirmed and 36 deaths. In Uganda, we have 833 cases and no deaths. This is the record as of the 27th of June, which is today. We also learned about the global strategic objective is to limit human-to-human transfer by reducing contact with people. So the World Health Organization introduced measures that will help people to stop or limit the spread of the disease. Different countries have introduced different measures, including quarantining or prevention of other people entering their country, and so forth and so forth. We've learned about the preventive measures. So there's no medicine for this disease. So it's all prevention, and prevention is by washing hands with soap or with, or using disinfectants. Why we wash hands with soap is because the virus can be killed or can be washed away when we wash our hands. So the main thing we have to do is social distancing to stop us catching the virus, because the virus can be caught when somebody talks or sneezes, or when somebody talk or sneeze, someone can get the virus, and they can catch it through their eyes, through their mouth, through their nose. That's why it's so important now. We have to cover ourselves using masks so that we don't get the virus. And also, we learned about the practical, to practice respiratory hygiene, which is like maybe covering your mouth with your shoulder to prevent droplets from spraying. And so basically, in summary, that's what we did. Let me introduce the panel properly today. As I said, maybe we'll have Dr. Roberts, who will join us later, but as of today, as of now, this is the panel. So we are going to kick off. I'm going to start by our topic today, which is the impact of coronavirus, which is COVID-19, on our lives. So I'm going to ask Dr. Marcelina, because I know governments introduce measures whereby people are told to keep away from having contact, but the doctors, they couldn't do that. They were the front line. So what is the impact of the coronavirus in your life as a doctor and generally? If you could start with you, please.
Wow, thank you very much, Modo. That's quite a big topic, or a wide topic to tackle really in this short period of time. Perhaps I will break that into maybe 2 or 3 areas. The first and foremost one would be the impact of COVID-19 on the doctors as healthcare professionals, and also the impact on us as individuals, and perhaps the impact on us financially or economically, whatever, personal and perhaps government or institutional economy. On the personal level, when this virus was declared pandemic, of course, yes, the way we've worked has changed. The way we look at patients has changed. Anybody, everybody could have the infection, could be a carrier. So therefore, when you're going to work, there is that element of, is there any chance I can catch it? And if I catch it, what about my family? Because remember, we've got families back home. So some healthcare professionals at the peak of this epidemic in this country have gone on to stay at work. So they don't come home. So you can imagine the disruption of lives or family lives in these healthcare workers. So they are staying at work, or they've secluded themselves somewhere until such a time that they deem it's now okay for them to come back home. So that's one aspect of impact. On the health care facilities or services that we provide, the way we work now has changed. So most of the work we do is by telephone. We still see patients. So the consultation is mainly done by telephone. And if we think or deem that it's necessary for you to come into the hospital, we then invite you at a designated time to come. We still address your issues. And the message out there is please try and keep away as much as you can. If it's something you can deal with, try and deal with it. But if it's something that needs medical attention, of course, obviously, there's nothing you can do. You would need to come in and be seen. But the idea is to try and minimize the number of patients visiting hospitals in order not to impact much on the health care system, so that it does not break down in just like in other countries that we see that have really been brought to their knees because of the overwhelming number of patients in the hospital.
But Dr. Marcelina, there are so many cases here, and UK is among the top ranking countries in the world with coronavirus. So you said the steps taken were to ensure that they keep control and not much of the disease spread. But UK is ranking very high. What do you think?
Well, what I think and what others think will come on board. Obviously, yes, we're ranking high. The question is, why are we ranking that high? The numbers are high, either two things. Because when measures are put in place, it takes the willpower for the people to carry on those measures that have been put. So even if the government says social distancing, if we are not listening to that, we are bound to go and get the infection. They talk of protective equipment to wear to avoid you getting the infection, and people are not listening or people are not doing it properly. Yes, again, infection is going to escalate. Look at the Bournemouth beach area. That was declared an incident. Why? Because people have flocked there to go and enjoy the sunshine. They've now forgotten that coronavirus is available or is on board. So these are the things. It takes two to tango, in other words.
Rodrigo, what do you think in that term that, although we're told what to do, we, the community, are not doing it, and because of that, we see a lot of cases of this virus in the UK.
First of all, thank you for inviting me to be on the panel in discussing today's topic of the impact of COVID-19. I really agree with what Marcelina has been talking about. But personally, I think I will analyze the impact of COVID-19 on political, social, and economic point of view, rather than the medical point of view. Socially, I know many people will agree with me that it will impact very, very severely. The world will never be the same. I can give a good example. A few weeks ago, I went to the post office, and there is the queuing system where you are supposed to maintain a social distance of 2 meters. I was literally 2 meters, but the gentleman in front of me raised a complaint that why am I moving more closer? And so interesting, the people behind me were all shaking their heads, and they were wondering what was going on wrong. But the message I'm trying to give here is that it is going into people's mind. And a person behind me gave a comment. I think in the future there is a need for us to move with step measures. It's like we should continue checking whether we are. So you can see how that one is going to impact very, very deeply in our social lifestyle. So socially, we are bound to see as disaster. I'm just giving you for the
Ferdinand,
second time. I'm giving
yeah.
you an example.
Ferdinand, what's your view? Can we hear from you as well,
I'm
please?
not finished.
I think let Rodrigo finish his line.
Let me think of the three elements. I'm just giving one example on each point. I've just talked about the social element. Politically, it is divided into two. Many politicians in developing or developed nations, probably, if you read the media, they have taken it in the point of view like some have taken that as an opportunity of amassing wealth and depriving others. So it's going to be a huge awakening. A good example in developing countries where oftentimes many people, whenever their family members fall sick, they are to take their family members for medical treatment out of the country to the decrement of their own health system. So to me, it's going to be a huge eye opener. Simply because as of now, they are unable to leave their own countries and go out of the country. And then economically, so many things have happened. Many people have lost their jobs. This is, to me, personally, supposed to be a period and a time for working together, checking on each other, making sure that we are safe. But unfortunately, certain people thought this is the time for fighting. Many people have lost jobs, many people have lost lives, many people are unable to take their dear ones to the nearest, health centers for proper medical checkup. So all this gave, rise to a lot of negative impacts. So those are the three I thought I should talk about: the political, social, and economic aspect of it.
Okay, thank you. Penalty, would you like to go?
Yes, please. No. Let me make a couple of points. First and foremost, thank you for organizing this event. The first event I wasn't on the panel, but I actually listening to it, and I'm grateful because it gave sort of baseline information on COVID, and this is a very good platform for continuing to discuss, because I, for one, would share this with you, Marcelina. You are in this profession, but my own daughter is a junior doctor now. But I think what transpired in the NHS is that they were all pushed into managing COVID. And in many ways, she's been actually picking up and learning. And one of the things I did was, in her first few weeks, I asked her to write for me one A4 side of how they handle COVID patients. And within 2 to 3 weeks, that changed such a lot. And so both in the medical profession, you clinical guys, and those of us on the outside, we're learning a lot about COVID. And in my case, because I'm more in research, I'm a research scientist, what we ended up doing is partly self-interest for want of money, because a lot of research money is going into COVID. So we are actually, most of us are writing proposals to get research funding to work on COVID. But it brings to mind one key thing. I think for us, this sort of discussion should also focus on what the government is doing and what we are doing in response to COVID, because these are two entities. The government has to take lots of decisions in spite of whatever scientific information and advice they've got. They've got to take decisions depending on what is it going to do to the economy. So the government decisions are distinct from what we can do. If us as people, individuals, know what to do in response to COVID, a lot of the things we should do in spite of the government. Government can take decisions which we don't agree with, but we should know certain things we should do for ourselves. So it's very important to distinguish between what we do for ourselves and what the government does. And Rodrigo has gone to the line because he's a politician. So somehow he has actually articulated that well. My interest is what we can do for ourselves. And I'll give you an insight into what one of the project proposals we are trying to develop. It might get funded or not, but even if it doesn't, this is the kind of information I base it on. The social distancing of 2 meters is something that is based on information we have. It is generic, and it is, I wouldn't say old because it's still relevant. Is when you sneeze, when you cough, how far do you project the sputum and or the droplets from yourself? So the distance that has been arrived at scientifically is about 2 meters. So that would be the same case for all the influenzas. That would be the same case for anything that is a respiratory airborne disease that you can expel. So that 2 meter distance has to do with how far you can cough, how far you can sneeze. But one thing that we don't appreciate, and I think this is quite important, is we're talking about the social distancing, but we never talk about social distancing at home, in a shop, at school, in the supermarket, or outdoors. So for me, that is very important. What we should think about is actually when you're outdoors, you are safer because whatever somebody has breathed out, coughed out, sneezed out will blow away. When you're indoors, there's a higher risk because whatever somebody sneezes, breathes, or coughs out will remain in the air. The 2 meter distance is the heavy droplets that fall down to the ground. What is not appreciated is that actually there are some finer droplets which actually hang in the air. They float in the air. They actually can be projected much further than 2 meters, the best part of 8 meters. That is the best size of any room we normally live in. And they hang in the air for much longer. And that is what we should worry about. The other thing which scientifically has not yet been proven is how many of those micro droplets does it take for you to be infected? Because as we know, you get infected. This is a good classic case of something like TB. We should go back and think about TB. The way in which TB is spread is the same way in which we fear the influenzas. But in many ways, TB is an old disease. It doesn't spread fast. And in healthy people, it is not the thing that will bring the world down. But in many ways, if you imagine the infectivity of TB and also the risk to the rest of the population, we should think about like that. The way in which TB is spread among people who are close-knit, living in close quarters, is the same way in which COVID-19 will spread, like all the influences. So let us use that extension. TB was the least infectious, maybe probably the one we survive best. But by extension, the influenzas, COVID-19 being the current pandemic, is the one we should worry about. The message that should go home. We have got the benefit of Zoom and a platform like this, but at home in the villages, we've got FM stations. The sort of messages we should pass home is what people can do for themselves before the government, because the government cannot do everything for us. The government does not always do what we want, but we should think of what our people can do for themselves. Let us develop and expand on the social distancing, but also explain it to people. Because I saw a very good article by this Mao, the leader of the DP in Uganda. He wrote a very good article about the Acholi who had something called, I think, Ngem or Gemo, something like that. It is a tradition that the Acholi have about social distancing when there is something like an epidemic or a pandemic. So these things are there in our traditions. Why don't we go back and bring that out so for people to understand? Now, in our own Madi in Uganda, that Magdek platform, recently we've been debating what is the best name for a mask. Now, it may be beside the point, but it brings to the fore that we need to talk to our people, explain to them how social distancing can help maybe mitigate the worst excesses of this pandemic. And for me, that is the most important thing to do. Now, if you think about the microparticles I'm talking about, which are there beyond the 2 meters, we should think about the schools, we think about the closed environments, we think about the churches. So the most important thing is that if I was to give advice to a village today, I would say the best thing to do is stay outdoors as much as you can. Stay in the sun as much as you can. And actually, you know what? If you must, the time you go to bed, be alone. And if you can't, keep it short. And that is the way in which we can actually drill down on this message of social distancing. Because if there is an outbreak anywhere, this is what I would do. If there isn't an outbreak, we shouldn't scare the people too much, because a lot of these diseases, we have survived them. COVID-19 is just like any of the annual influenzas we get. Some people will die, especially the vulnerable. But by God, if we can be careful enough, we will reduce the number of fatalities. But if we can't, kind of like, so be it. But we shouldn't have that for not trying. So
I,
this kind of platform
I,
that we continue to
Yeah.
develop should have that message at the back of our mind.
Thank you. And so I think the coronavirus, really, there's a lot of fear, especially when we hear such information like what you're saying, Dr. Ferdinand, that, the distance, when you cough, we are even not sure whether the 2 meter distance is enough. This is creating a bit of fear, I mean, to the community. Dr. What would you say about this?
before
Dr. Marcelina.
Sorry, I didn't get that
Yes,
question.
I said, there's a lot of fear now, with the information going around, how to protect yourself and to prevent catching coronavirus. The fear is, like what Dr. Ronald was, Ferdinand was saying, that the 2 meter distance might even not be enough if someone coughs, because we're not sure how far that cough goes. So this alone will create fear, because I'm not sure whether the 2 meter distance I'm keeping, is even enough, or whether I'm still exposing myself to the disease. And, there are other situations where we are even not considering this social distancing. And most of those places are where we go to. Like when we meet families, it's very difficult to keep social distance.
Well, I tell you what, it's one of those things that are difficult. Like Ferdinand had said, yes, those particles that we cannot measure are the ones people don't concentrate on. We're aware of that. But again, bringing the nitty-gritty to the population, I think probably is going to scare everybody off. Now, the 2 meter distance, I'll give you an example of my own experience, just as Rodrigo did. I went to a chemist and we were standing in the open air, keeping our distance, waiting to go into the pharmacy. Lo and behold, this lady comes marching about, and as soon as she got there, out of my way, I live here, I want to go by. I said, hello, we are not in your way, we are standing in the common pavement. She wanted us to physically move away so that we give her way to pass. And then she goes on to say, it's supposed to be family alone. I don't know what you guys are doing. Simply because I'm Black, and the people that were standing 2 meters or roughly 2 meters away from me were Asian looking. So now you can see what kind of picture or message this kind of social distancing is taking. It's driving people mad. There are a lot of mental element issues with this coronavirus or COVID-19, whether it's actual mental issues or other impacts. Now, like I said, this is a very long topic. We can talk about maybe next time and next time, because we cannot finish this within this short period of time. People back home, let me just make my point.
Can I say
the funny thing, let me just finish this. The funny thing is, people back home, when I spoke to somebody with this situation, they don't see COVID-19 as a threat. It told that this is the illness of the rich. Simply because in my country, South Sudan, when people stand in front of the television to parade themselves and say, I tested positive, those people were politicians. The vice president, another vice president, and the wife, and I don't know, minister who. So the people in my village think this is the illness of the rich. So how do we reach them? One of the audio clips that I did send, I did tell them gathering in funeral places. This is exposing you. If there is way of doing it, please keep the body in the mortuary. This is another audio I'm coming to produce, which will come out soon, to talk about how to handle or how to behave in these areas in order to bring about the social distancing. Thank you.
The one thing
Yeah.
I'd wanted to say, just as a rejoinder to Marcelina and Rodrigo, is that actually we should be mindful that society is as complex as has ever been, and there are certain things we cannot change about ourselves, including things like racism. So those of us, all of us, we live in the West, and we encounter racism all of the time, but we're not actually deluded because we have racism even at home. You know, there'll be different tribes against the others because of the shade of color of the skin or some other things. But what is important to note, given COVID-19, is that you will find actually as you go out in your daily business, there will be those people who don't like the look of your face, the color of your skin, and things. They use the COVID clause to put you in your place. So
And I,
simple thing like queuing, they don't like the look of your face. They use the COVID clause. So let us accept that, and let us know. Let us be a step ahead to always defend ourselves.
I am not bothered about
I
such
think I wanted
comments. To be
to.
honest with you, that doesn't bother me. It doesn't sway me from what I think. And I speak my mind. When you
I
say
am,
that, I speak my mind.
I am glad that Ferdinand Lally brought this up about the question of racism and many others. But let's not forget that this is purely political. A good example I can give you is something to do with the impact of COVID-19. Is there are so many government pronouncements which makes it to appear that people of color are maybe the main spreaders or maybe causes of COVID. A good example, like for example, there is a talk about the need for testing vaccines. And of course, frontliners became targets and the people of color. Now, the question is, what does that message, how does that message properly filter to the mainstream community? That clearly signals that, well, because of your color, probably could be a possibility. Look, take example of what has been happening in China. Black people in China are being, is like they are being looked at as spreaders of COVID. So it is purely political and it is bad politics to make it appear that no, I think the cause of this could be coming from Black people, and that will definitely continue to build racial tension among our community. So I really agree with what Marcelina and Ferdinand have just been talking about. But again, as a
Yeah.
researcher, you talked about your point of view that people should continue being more outside and then inside because but again that also contradicts political pronouncements earlier that, well, if you are not well, you have to keep indoors. You don't need to go. You don't need to get out there. So it's a bit confusing. I don't know how we can easily practice that.
I can
And
clarify
Yeah,
that.
answer Ferdinand before you come to answer that.
Okay.
The issue of the Black and ethnic minority maybe being seen as spreaders of the infection. Let us not forget, let me just clarify one thing. Let us not forget that majority of these people, if they got infected at work, who are the key workers? That's what you need to look at. Who are the people doing the cleaning, the porters, the nursing? Who are they? These are the people who are more exposed to the infection. So it's not necessarily true that it's anything to do with their being Black. And if it is, majority of the Black and ethnic minority people have underlying problems. And we do know that with underlying medical conditions, your outcome is not going to be as good as somebody who is healthy, who will bounce back. So this is something I want to clarify. Yes, there's always the political element, if you like, or drive. People are motivated or people are driven by saying what they want based on what their beliefs are. But these are facts that do not change the fact that the Black and ethnic minority people have died or are having most of the coronavirus because of the jobs they do and because of maybe socioeconomic backgrounds. A small room like this may have 3 generations in there. They cannot afford a house with a compound all this kind of thing. So with regards to the vaccination and the move, I think that would be the field of Ferdinand. I'll leave it for him. I just wanted to clarify this. Thank you.
Okay. So I'll say two things at the end. If I don't forget, I'll make a comment about the vaccines. The first is the clarification, Rodriguez. My point about outdoors is simply this: I'm looking at ourselves living here in the UK, who are our life is mainly indoors, and that is the reference I make. But you'll probably know that people who have got TB are often advised to sit out in the sun and this and that. But what if you look back at most of the social media we've got and some other advice, including advice from medical doctors these days, there's a very strong emphasis on taking vitamin D tablets,
Yeah.
or actually making sure you're out there in the sun. And that is a good reason of being out in the sun. That is a benefit that you can get without having to go to a pharmacy. The other thing about being outdoors is that simply it removes you from another human. It also gives you ventilation. It gives you it puts you outside in the sun. But very importantly, the thing is this: if somebody sneezes indoors, the droplets will circulate and hang around long enough for you to sniff it. If they sneeze in the garden or outdoors, it will blow away. So that is the simple difference between being indoors and outdoors. Outdoors, you've got the sun. Anything somebody sneezes blows away. Indoors, you don't have the sun, which is actually a good source of vitamin D, which is very protective. And anybody sneezing, however many they are, will hang in the air. So imagine a church, imagine a classroom. That's the worst situation. Imagine you sitting out with a friend at the beach. Is probably in the UK sense not a good place because people go there in big numbers. But at home, you go in the garden, you go outdoors. You are a lot safer, if not on your own, with just one or two more people outdoors. So that makes a huge difference between being indoors and outdoors. Now
So, yeah,
about
go.
vaccines, what I would say is this: we know we always the MMR and whatever vaccines people get from childhood, vaccines are the way to go. If there is a vaccine that is being validated, I would take a vaccine anytime. What I don't know, I'm less keen to comment about, is because coronavirus has been so politicized. We unfortunately have a huge number of our so-called, in UK terms, BAME, the ethnic minorities, who are more vulnerable. By nature, I believe, like Dr. Marcelino was saying, then the nature of their work, they are much more exposed. That is the reason. They are not spreaders. They're actually the vulnerable. And in many ways, whether we should target them for vaccination, I'm less sure, because I would not be selling that idea to a very close relative of mine because they are BAME. I may be wrong. I'm happy to be corrected on that. But because coronavirus has been so politicized, I'm less keen to make a judgment on that. But I know for sure a vaccine that I know to work is the thing to do, the thing to use, and I would take it.
Interesting. All right, Rodrigo, yeah?
Yeah, I wanted to bring a point on the impact in relation to the economic point of view. If you look at it carefully, the world is becoming more digital. Look at what we are doing right now. We are online. And also, even if you want to do shopping, you want to have meetings, you want to attend lessons, it's like work is becoming remotely. How will that affect our own people back home, where there's no proper means of communication? We don't have the power, we don't have the phones and the laptops. It's like one of the impact is that soon or later everything is going to be done online. How are we going to be able to cope up, leave alone people from Africa, but even within the UK, because many of us are unable to use the gadgets that we are supposed to, and that is where it's going to hit very many people hard, because most of the things will be done online.
Yeah, and with the shopping online, for example, it has caused a lot of more problems because there's a lot of waste that is being disposed. People are buying in bags and they are disposing the bags, and recycling is becoming a big problem now with a lot of things that need recycling, and with some countries also stopping recycling because of the safety of the people working in that industry. This is another impact, coronavirus has created, and has caused lots of loss of jobs as well. So people in that area have become redundant, and probably that's also a big cause of the mental health of the people. People don't know where to eat tomorrow. They don't know how to. They can't go out to hustle. All of that. So I wanted to find out, Ferdinand, have you done any research in that area?
Not specifically, but I've got a view about that, because if you think about the way I speak for myself, and I think probably for Rodrigo too, if you think about the way we grew up in our early childhood in our villages and homes, and you think about how much government was part of your livelihood. I can remember only 2-3 things. This was like the mean days of economic war. You knew about the government when you ran out of salt or sugar, but otherwise you got by and made do. And in many ways, our people, especially the rural population, can actually survive in spite of the government. And if something horrible happened, I actually think the rural population would be the bedrock. The ones in the urban population in the cities can decant and go back home, because if they haven't got a job and they haven't got a livelihood, they can actually get by at home. I'm not prescribing that, but actually, if it came to that, that's what I would do. You will survive and come back to the city when there is a job for you, and you'll continue from there. Because in many ways, we have to ask ourselves, we live in this system where there is internet banking and all of that. One day, this can stop, like COVID has threatened to. But if that did, are we just gonna drop dead? Here in the UK, I think I can. I'll probably drop dead. But if I lived in Kampala, I'll go back to the village and I'll get by, because we'll go to the farm and plant our own food. And I think there is a safety net there we have more than we all have here in the UK.
Yeah. Mm.
Yes,
I do agree, but then
I do agree with that. Sorry, let me budge in. I think, yes, the impact of this coronavirus has been both personal economic problems and the government or state economy or economic issues. On the personal level, I do agree with you, Ferdinand. If I were to live back home, I shouldn't even be in the cities, because we survived way before the digital era came. And in the messages I've given on the various platforms where I've spoken about COVID-19, I've advised people, don't just sit and fold your hands. If you've got a little plot of land, try and produce something. Right? Produce something that will sustain you for the time being. Now, in terms of the government aspect of the economy, yes, unless governments put measures in places for us or for them to survive and get resources, then yeah, things are going to make a very bad U-turn and go downhill. And I don't know how that's going to be mended, because I am not a politician. Rodrigo can obviously
The last word, Rodrigo.
that's his field.
I just wanted to add on a positive note, following what Marcelina and Ferdinand have just said. I've been in touch with people from my own village, that is in Uganda. But what is so interesting is that they were trying to appreciate the lockdown in such a way that it gave them the opportunity to pick up hoes and go and dig. And as a result, as of now, there is a high likelihood that there will be high yield of crops, which whereby there will be no situation. So it is like, this is a good moment for many young people to pick up and look into a way of going into agriculture, because they are unable to come around, be in towns and do nothing. So they were able to acquire some pieces of land and they were able to cultivate. And it looks like it's both negative side and the positive side also. So this is just to add on to what you have just spoken.
Yeah, nice to hear that. You know, the messages, people receive different messages. Like in South Sudan, when I called my sister, she says people are cursing the rains. You know, when they see that it's about to rain, they are cursing because they believe that, cold weather brings the coronavirus. And they are saying, no, we don't want rain. We don't want rain. You know, rain, go away. You know, so they think they are safe when there is a sun, they can sit in the sun. And when there is rain, they are likely to get the virus. What is your take on this? Dr. Marcelina, what do you say?
Well, if this COVID-19 were to die in an area where there is heat, it shouldn't have survived in Sudan or South Sudan. Let me make that clear. So let us not be deluded. The virus is there, and whether there's rain or not, it's going to affect people. The measures that have been put in place are the ones that will prevent you from catching the virus. So if there's anything, people should not curse rain. People should embrace rain to give a cool climate, so that even if somebody were to suffer the infection, at least they can get some respite from that terrible weather that will even drain you and make you more sick when you've got the virus. And also do some cultivation.
Ferdinand, yeah, go on.
I would say a couple of things after Marcelina. Thank you for what you said. Two things. First and foremost, our people are agriculturalists. We know what rain means to us. So the first rule is we need and want rain. That has always been the case, because without rain, there is no crop. Today, the generation might be conflicted because of what they hear on social media about the cold and the cold bringing the copy. Well, there is some truth in that, because we normally get the seasonal flu come in winter. So these flus are more efficiently transmitted during winter. But that doesn't mean cold is all hell let loose, because rain at home is not cold as winter in this country. So let us welcome our rain. Let us keep our rain, because our rain is not winter as here. Because here in winter we get the flu. And then the other thing I wanted to say was actually very clearly, you have got a case of people calling it the disease of the rich. Let's say in Southern Sudan. You know what? You heard Donald Trump talking about they've got a lot of cases because they're doing too much testing. They should probably go easy on the testing. And hilarious and comical as it might be, you can say the same about South Sudan. You know, the people you see testing positive are the very few people who had the opportunity to be tested. Okay? So there is a flip side of that coin, and it is not a rich man's disease. There's a lot of people who will be dying unknown. There are people who are actually not symptomatic. They have the disease, they survive it well, they don't even know. There is the other extreme in public health terms, that they actually die. We don't even know they die of this disease until actually it spreads in the village. So the very, very strong messages we should take are, what can we tell our people on the FM stations, in the churches, and especially to emphasize the story, the message that Marcelina had, the funerals, how people assemble and manage funerals. We should have very strong statements from our strong leaders in the community about those cases, because those are the avenues for this thing to spread. And especially if we have sufficient testing to know there are cases in the community. Once we know that, we should go hard on the FM stations, in the churches, and some other media sources to make publicize that, please step back, because it is dangerous to be in close proximity, because what your relative that you're mourning has died of will take you to that same grave.
I've got a question for all of us.
Yeah.
In appreciation for as a way of sustaining and keeping control of COVID-19, many governments in Africa have taken very tough measures, such as beating up people who are assembled in certain areas. That had happened in Kenya, in Uganda, in South Sudan, and in many other countries. what do we think of those very tough measures in trying to make sure that people are managing to contain the spread of COVID-19 in terms of the very strict enforcements?
Mm.
Is it a good thing?
Can I say something? It's a I think that's a very big topic because because I've seen aside from beating up, there are also strict measures in that, like here you cannot go to the church to pray. For me that's a very strict measure because I would love to go. So I think it's a very big topic, and now we have arrived to the end of our 1 hour. Maybe we can pick it up from next time and discuss that. We can go in detail with that, but for today, we're going to round up and we'll meet again. So the message today we are taking home is COVID-19 can affect anybody and it can have an impact on anybody. It doesn't matter your race. It's more among the Black, the ethnic minorities because of what they do, their type of jobs. They are more exposed. Their work exposes them more than the other people. And because of that, most of them can get those diseases. We've also, we take home today that there are measures we can put in place to at least minimize the spread of this disease. We can copy what we used to do with TB, because they are similar, the way it is spread. Airborne, from person to person, coming close to that person who has it. And we should adapt ways whereby we can minimize this disease. I would like to thank all of you very much for coming to the show today. We will continue next time. I would say bye-bye.
Thank you. Bye-bye. Bye-bye. Bye-bye.
Bye.